Hi, this is Dare Baskin with Saving Med. Here's the question I'll attempt to answer today. How much does the United States healthcare system cost? So let's define that question by more specifically saying how much money is spent on U.S. healthcare in a given year. And so, for instance, we have data from 2022. This is from CMS, Center for Medicare and Medicaid Services. And this is just part of a pie chart. This is the very first one. This is dental services. And where it's the number there is actually 165,276 million. So just so you know, these aren't hundreds of thousands of dollars, these are billions. And I don't want you to be overwhelmed by the details of this pie chart. You'll see there's quite a few categories here. Part of the sinister way that healthcare in the US has defied public understanding is due in part to its complexity. If you ask the average doctor or person on the street about how healthcare in America works, it's actually quite hard to explain. There's very few doctors who really understand it well, actually, myself included. So there's really no getting around the current level of complexity, but we can try to simplify it and work towards a better grasp of how it works. So here's the biggest cost: hospital care. That's $1.4 trillion. Clinical services are almost $1 trillion. It's like visits to the doctor. Prescription drugs, $400 billion. And this is in 1 year. And then we have something called net cost of health insurance. This is our fourth largest cost of our health care system. And net cost is basically the total cost to administrate a plan. It's the overhead. This includes, paying the employees' salaries that work at the health insurance company or at Medicare or Medicaid. This includes advertising, marketing, if such a thing exists for that entity. And of course, this includes salaries for CEOs, if there are CEOs. And many of you may know that CEO salaries in healthcare organizations can go above $10 or even $20 million in a year. So the total spend on U.S. healthcare in 2022, if you take that whole pie chart, add up all those numbers, we get to $4.5 trillion. $4.5 trillion. And then if you look at the population of the U.S. in 2022, we had about 333 million people in the U.S. And if you take that 4.5 trillion divided by 333 million, you come up with this figure. This is $13,400 per person in the U.S. on average. Of course, there are quite a few people who never went to the doctor in 2022. And then there's quite a few others that not only went to the doctor, they might have been admitted to the ICU or the NICU. They might have gotten chemotherapy and other wonderful, miraculous interventions, but that also costs the healthcare system money. So let's think about how our U.S. healthcare system compares to other countries. And how do we know if we're getting a good deal for what we pay? Well, we're going to start by comparison shopping other countries' price tags. This doesn't really tell us anything about the quality of the care given, but you really have to start somewhere, and you might as well start with price points. Those are a little bit easier, frankly, than some of the other data points. And so we just looked at 2022 data for the US. That's the most recent data we have. But if you look at the vast majority of countries, 2020 is really the most recent year for which we have data. And this data comes from World Bank. This is easy to download an Excel spreadsheet or some other format to compare these numbers. And what I did is I selected, you can see these 16 countries at the bottom of this soon-to-be chart here. And these 16 countries are the richest countries in terms of gross domestic product per capita, but that also had at least 8 million people in population. So if there's a country of 2 or 3 million and they were richer than one of these, I didn't include them because quite honestly, we have over 300 million people in the US. I wanted to make it as fair a comparison as possible. So we have 8 million people and over, and then I took the 16 richest countries within that grouping, and this is what we have. Why 16? I don't really know. I just kind of got tired of going all the way down to plus 20. It gets really congested. So we have UAE. This is the cost per capita in 2020. So the UAE spent on average about $2,000 per person on healthcare. Go to France at $4,800, and then on up to Canada, $5,600 per person. And then we got all the way to Switzerland, and of course, United States will be higher. This is from 2020, so it's $11,700. We've gone up since then. Of course, everybody tends to go up over time on average. So what you could see here is that we're paying quite a bit more than the average country here. Most of these European countries are not really paying nearly as much as we are. So how much does the U.S. healthcare system cost? Let's wrap this up. Answer is double that of Europe. So coming up in future questions are the following. So where's all the money that we're spending coming from? Which U.S. healthcare entity, such as Medicare, Medicaid, Indian Health Service, VA, private health insurance, which of these entities is the best steward of its funds? And since we are paying double that of Europe, do we receive double the benefits compared with Europe? So we'll try to answer these questions in upcoming videos. In the meantime, you can go to savingmed.com. And thank you again. This is Dare Baskin with Saving Med. Have a nice day.